I'm not a good speaker on it. The main thing is, he said Ebola's not airborne, but we do not want to touch that patient. We're not gonna touch them at all. We'll room the patient and we'll have a buddy. You get a buddy, and it's best to room the patient where there's a room across the hall where we can dress in. Okay, might not always be able to, but we'll try that. We're not gonna take their blood pressure. All we're gonna do is ask questions, okay? If we have to take their temperature, we're gonna lay it on the table, which we will take it. We'll have to lay it on the table with the cover over it, let them pick it up, take it themselves, okay? And then when we're finished, we have to clean it with these PDI wipes, okay? Also, while I've got this in my hand, if they should happen to vomit on you, like, and it would hit your neck, we're gonna get one of these and wipe it off the neck, and then after that, you go wash it with soap and water. Okay. If they happen to be sick on their stomach, we don't even touch the trash can. We're just gonna scoot it over there with our foot, he said. Okay. It takes 14 to 19 days to recover from this. If we should happen to have a fever, been around somebody or have a fever, we take it twice a day, but we can still work as long as we don't have a fever. Okay, we still work, sorry, and we'll have to do that daily. Okay, if we have a patient that comes in here with this and we're treating them like that, and the doctor decides they may have this, Air Care's supposed to come and pick them up, believe it or not.
Wow.
They will put what they call an ISO pad on the stretcher. It's like a tent. Y'all may have seen pictures, and it has holes in it where people can stick their hands, or the ambulance people, whatever, can stick their hands in there and treat or do whatever they need to do. And it'll stay on. It'll be placed on there as soon as they come in until they leave here. We've got our Ebola kit. Now, we're going to start getting ready to go over the dressing part, but if you do need to go in there, you need to be sure you take off all your jewelry, rings, everything, before you go in that room, okay? He said if not, you may lose them, so I hate for somebody to throw away their diamonds or something for wearing them in the room. Okay, all right, see, you want to come up here and me and you'll practice on getting dressed. I'm going to dress you, okay? Let me get my shoes exactly what we do first, and I'll throw it out. We put the gloves on first.
Lisa, if you want to wait just a second, Dr. Lance just walked in. So he just walked in, so I said, oh, you're just in time.
So I got a question. Would you actually room the patient before you dress, or you get dressed and then room?
We'll room them first. We'll put them in there first, then go get dressed and room them.
Just don't touch
They're
them.
going to have a mask on anyway, right?
Well,
We're not going to touch them.
The goodness of me, when they come to the front window, we're already exposed.
But you
so
know what's
everybody
another
in the
thing?
room.
Julie was saying too, like that's one of the most humiliating
Oh my goodness.
things
yes.
ever. I got a feeling they're unable to control things, and don't you? I sound like I'm in there throwing up. Hopefully, they're not that bad yet when they come in here.
They're not coming in here.
Hopefully they would go on to the ER or somewhere.
I'm gonna put your shoe covers, put your foot up here, because I don't know if I can get down there.
Has Dr. Lance ever put these booties on before? You think he knows how to do it?
See, he when we were in this meeting, he thought they would be boot covers, and I don't know why they're not, but apparently they don't have to be. So she'll step away, and the buddy in the room, which would be me like now, whatever, we have to spray her all over with this bleach stuff. Well, not her head, I don't guess, but
Her mouth.
gown and everything.
Open your mouth.
Okay.
And
It
then
probably
that
would be
was- that
irritant
was
to the
fighting
skin
the
if you
scrubs
did
in
have
the
the skin.
skin.
Yeah, we just do her gown and her gloves and stuff.
If it's false.
Okay. And once we've done this, we'll take your clothing off, keeping your inner gloves on. We'll move to a clean room to remove your inner gloves.
Move to another room, have to decontaminate.
Did you take your scrubs off?
Okay, so taking them off.
No, that's not what she's saying.
So you would think, in the same thing I got on to take mine off.
Well, actually, I know you take it off.
Oh,
Yes, I'm gonna tell you what to do.
So should we like have an old set of scrubs from the hospital or something?
We have them.
Or, yeah, and so that before you start to take your clothes off and put those scrubs on, so if you're gonna get sprayed and everything.
That's
so-
what I was thinking.
Someone's gonna allowance for a scrub.
Someone's gonna buy a new pair of pants.
So maybe we need to put a set of scrubs in with the kit, and that way you can put those
put
on.
those on before you enter.
Yeah, see, that's why we had those, legs.
I found gold, I put it to the back.
But anyway,
And that's just a thought, but
if they don't vomit, you haven't done anything, we're gonna step into a clean room. You haven't touched anything. I'm gonna spray your hands and form. Okay?
You're on video right now.
And then you're gonna slowly pull your own gown off. Okay? You just leave your gloves on, you're just gonna pull.
Like my stats on.
Yeah.
So
So you're gonna pull it on slow, and it should burn. I might hide that.
No, she undresses herself before you get trained.
You just
Okay,
got
now
Ebola on your
take
neck.
this, take it, this, right here, and pull it, just pull the whole gown off slow. Pull it forward, pull it forward.
Somebody get some
slow.
music
Now
for
wait.
it, please. You're
gonna knead it in your hands up into a ball, start kneading it, pull it off and knead it. Knead it all up into a ball. This down here and open. Bag.
Get your string off before Cindy Lou. Do it up right,
Or just contaminated the carpet.
Oh, great.
Oh, man.
Guys,
So you wanted your
very
outerwear
seriously,
gloves to come
this
off
is
the
the
gown,
most
which they
dangerous
did.
part of
No,
the
they just
procedure.
need it.
Yeah.
This is when all the contaminations with the nurses is believed to have happened, is on degowning. It's not actually while you're in the room,
Okay.
it's
I'll take
getting the
sheet
stuff
covers
off you and not touching yourself.
With these,
And step over to the side.
And this is why I realize somebody
Step
else
away
should
from
take
it
off
and
your
take
stuff,
that one off. Yeah.
so your buddy that's clean
Then you
should be the one that takes off all your stuff. And then
Like
you,
this, we still.
then your buddy who's
Don't hand it to me.
theoretically hasn't
And
touched
then
it,
I have to
should
actually
be able to degown
snip.
without, with
oh,
less risk.
Lord.
You actually cut this off, okay?
Goodness.
Can we take a year with
Wash
us?
your scissors.
Yeah. Don't do it when somebody's mad at you.
Turn around. I'll put the other side.
We will have a fresh gerbil.
And then I can take,
Is that a sterile, is that like sterile scissors?
They're not anymore.
I'm saying,
You have to wipe them down.
I was gonna say, but, or should it be sterile scissors is what I'm saying in the past.
Yeah, no, it doesn't need to be sterile. Just something you can throw away.
Okay, you got your, take your thumb when you take your gloves
Yeah.
off like that.
yeah, that's
And
what,
then just
yeah.
you go wash your hands and stuff. And feet it.
So then who cleans
So
this mess up?
they're saying that the person who, like Cindy would take her own stuff off.
Yes.
But Dr. Lance was saying that somebody else
Somebody
has
else
to
takes
take her
it.
stuff
No.
off.
The appropriate way to do this, if you're truly exposed, is get somebody else who's very comfortable with what they're doing, probably myself or one of the other physicians, have us gown, have us disrobe you. Okay? If there's a true exposure, let's say something is truly exposed here. Number one, okay, just so you know what CDC recs are. CDC recs are you get something about like what she had there. Okay? Then you go on and you regown and glove with the spacesuit like they use in Bones and Joints, including the helmet and the whole 9 yards. 2 people are in the room. The person that's coming into the room, who has not seen the patient, touched the patient, been near the patient, is then the one that disrobes the person that's been in the room. So, if I was coming in to assume care for the patient, I would come in, and I would disrobe the outer layer completely. Then, having done the outer layer, ideally without contaminating the inner layer, I would let her disrobe her own inner layer. Because I don't want to could possibly contaminate whatever I touch in the outer layer on the inner layer. And then I'd let her disrobe her inner layer. Then she would leave and go do her shower or whatever she's going to do for decontamination. For our purposes, we don't have a second set here. So what they're asking us to do is if you are truly exposed, if it's more than just, hey, I was from me to Megan in the room and I said, go in that room there and sit and don't move and trying to touch a lot of stuff, and we'll call some help. If I did anything more than that, then get somebody else that's very comfortable. Okay, and nothing personal, but you know, Alta and Tim, don't do this stuff on a regular basis. This is the high risk part, is taking it off. It really is. So get somebody that's very comfortable with how they're going to take off their own stuff, and let us put on new stuff, completely clean, come behind you, take that stuff off, take yours off, so that you're clean. Then you can go, and then I'll work on disrobing myself. Does that make sense? Because just in the way she did that, if those gloves, if you don't have two sets of gloves on, when you pull that off, you run the risk of contaminating your wrist right here. Okay? Just because when you pull the gown off, the gloves weren't attached inside the gown, so it's going to open up a little spot right there. I mean, there's all kinds of little things like that. Ideally, the gloves will be, you'd have a set of gloves underneath and a set of gloves that go over the gown. And when you take the gown off, that top layer of gloves is going to come off with the gown.
So they tape to it, right?
Yeah, you can tape them right on there. And so that whole top, the gloves come off with the gown. Because if the first set of gloves don't come off with the gown, then you're going to leave exposure.
I think those gloves right there, they're 12 inch.
Supposed to
They're
be long, we just use what we
longer
have.
ones.
Right, but again, you just get somebody else to help you